Then we mute first, preparing to live. Hi, good afternoon, everyone. Thanks for joining us, Liyana, our in-house clinical psychologist. My name is Charlie. I'm a registered counselor for Mind Story. So this afternoon, we're going to talk about with Miss Liyana about working with a clinical psychologist. So we're going to briefly talk about what they do, what are their focus with when they're dealing with children. Okay, so thanks for joining us today, this afternoon, Ms. Liana. So, okay, if you have any questions, please do put in the comment. So, yeah, we will see the comment and answer as much as we can. Okay, all right. And then for those who would like to have information or about role of a clinical psychologist, do let us know. We'll put the link there. You can register and we will send out the slides to you. Okay, all right. So how are you today, Liyana?
Thank you, Charlie.
Can Can you hear me?
Yes, clear.
Okay, very good. All right. So yeah, I have questions that people have been asking me. You know, when parents they approach us at Mind Story, they have questions about like, what do a clinical psychologist do? So these are the common questions that I would like to discuss with you today, so people can know more about what do a clinical psychologist do. Okay, so one of the most commonly heard questions that I have from parents is, what do you do as a clinical psychologist?
Okay, all right. So for those who are not familiar with clinical psychologists, so basically, a clinical psychologist, we are trained to do assessment. So we are also trained and eligible to diagnose certain disorders. All right. And then we formulate, sometimes we do formulate, when we have the cases, we formulate the cases so that we know where to start the intervention plan. And then after that, we would also have to provide the psychotherapy or what we call the intervention sessions. Yeah. So basically, that's what we do as a clinical psychologist in general. That's what we do.
Okay, all right. So yeah, and then the second question will be like, you know, after parents come to me and they ask about what do a clinical psychologist do, and then the second commonly heard question is, how do you screen and diagnose a child with special need disabilities? Because normally, if we talk about diagnosing, screening, we always talk about medical doctors. So that's where parents was like, okay, so basically clinical psychologists working with like child, or you know, provide treatment plan, psychotherapy for children, in particular in our setting, children with special needs. So when we come to talk about diagnosing and screening, how do you do that actually?
Okay, so first of all, there are several processes that you need to do before we can diagnose a child, right? Especially when it comes to a child, we need to cater the basic function, which is the organic practice. What do you understand by organic practice? So when we say organic practice, means that the medical practice that we need to rule out before we can diagnose or look at psychological symptoms. All right. So first, before we diagnose a child with special needs or disabilities, we would ask the parent to go through with medical doctors first. All right. So sometimes you can go through the KK clinical psychiatrist first and get referral to the special doctors like the Pakala, the Paka. And then what we do next is they rule out any the organic symptoms, the medical symptoms. That's why we sometimes, before the child before the parents wants to do the diagnosis, we will always ask, if have you gone through ENT, like through our medical practice that actually contribute to the, for example, speech delay and not responding to call or things like that. So we would always want to rule out the medical practice first. So after that, then we would see whether if the child is suitable to do a diagnosis. When I say suitable, it means that it fulfills certain criteria. For example, if the child is too young, then it's difficult for us to see the symptoms clearly, right? And then if the child is incapable of doing certain things, so we need to see what other conditions.
Sorry, Liyana.
Yes.
Sorry, I have to stop you for a while. We have a comment from saying that your audio is breaking.
Oh, is it?
Yeah.
Is it still breaking?
I think yes. From my end, I don't really hear any breaking.
Okay. All right. All right. Should I continue?
Yes. For now, let us continue first, and I'll see how it goes. Yeah.
Okay. So just let me stop me anytime when there's difficulties. All right. So like I said, after seeing the ENT, you'll see the basic things. Like for example, sometimes people will say that, oh, my child is not socializing well, my child is not communicating well. So before we do a diagnosis or the assessment itself, we would always want to this is what we call history taking. We would find out the background factors. For example, if the child is always being left alone without interaction, without any social interaction with anyone else in the house, just let them play alone and that's okay for them. So that is where we see lack of social communication or social interaction. So it's not fair for us to actually diagnose a child with, like, for example, um, speech delay or lack of communication just because there are lack of exposure within that area. So we will always want to go to those background informations. If they are having lack of exposure in certain opportunities in that area, for example, social skills, communication skills, and daily activity living. So if they are lacking exposure, we would definitely would want them, the parents, to monitor first. For example, we would like to monitor for 3 to 6 months. If, like, for example, parents can't do it alone, they would always give a referral for OT or ST, whatever that you need to help the child. So if within the 3 to 6 months, the child is still displaying those symptoms, then we would advise to come back and we'll start with the diagnosis. So with the diagnosis, before the diagnosis is some good assessment. So the assessment itself, for example, is different from a category to category. For example, there's different assessment for autism, there's different assessment for ADHD, there's different assessment for SLD. Right? So within the assessment itself, we would need to know whether which category is fit for the child. Right? Sometimes the parents would ask, can my child be diagnosed with 2 diagnoses? And there is a possibility for that as well. So we would always advise parents to actually monitor the symptoms within the 3 to 6 months of the observation. All right. So then we would slowly and put the category on the case. All right. So yeah. So sometimes that's what we do, or just to make sure that we don't overlap with medical symptoms and psychological symptoms.
Right. Okay. All right. So, in short, those who have difficulty listening, I'll just basically summarize what Liyana have shared. So basically, for screening, clinical psychologists, they have to consider a lot of things like the psychological factors, okay, as well as factors like the social, the surrounding that affecting on a child. So before they do diagnosis, and true, but what it means by screening is she will go through with the parents a background of the child to know what's happening, what's the onset. And she also mentioned that you can screen and the child at the clinic kesihatan or any GP and doctors, okay, and then only they will refer you to a clinical psychologist. Okay. Also, Liyana shared that there's a lot of diagnosis available or different types of assessment for children with special needs or disabilities. Okay, for example, autism and ADHD. And also, Liyana mentioned that for certain type disabilities that requires other specialty like speech and language therapies, okay, they will do some verbal or language. They will screen for language and communication disorders, and then if there's another factors that affecting them, that's where they'll refer to you. Am I correct, Diana?
Yes.
Yeah.
You got that, Richard.
Yeah, so for screening part, that's basically what clinical psychology do. They go through your background, they ask parents, they interview parents, they interact with the child to see if there's any characteristic of special needs or disabilities, and they do different types of diagnosing, okay, and different types of assessment for different types of special needs or disabilities. And they also work with other health professionals, okay, like speech and language therapies, and also doctors, so that you mentioned that, so that you don't have clash in terms of treatment intervention. Am I correct? Okay, very good.
Yes, that's right.
All right. Okay, this is where related to the previous question, whereby I've parents asking me, what are the type of disabilities or special needs that require to seeing a clinical psychologist?
Alright. So when you mentioned just now what types of disabilities are required to see a clinical psychologist, right? So when we say types, it refers to basically the clinical settings, like clinical disorders. Like for example, if you know that your child is maybe presenting several behaviors, particular behaviors that are maybe close to symptoms like autism, with tantrums like meltdowns, things like that. So those are types of disabilities that we have to look, because sometimes when there's tantrums or severe meltdowns, that we would sometimes relate it to autism, all right? And if there are very energetic, very hyper, very active at 5, 6 years old, so that one would be around staying around like ADHD. All right. So those are the types of some of the types of disabilities that we actually look at. And we also see children with SLD. SLD is specific learning disability. Right. So usually a specific learning disability we always look at after they get a formal education. For example, standard 1 or standard 2. So basically standard 1 and above. Right. So when there's difficulty with reading, difficulty with identifying the ABCs in 1, 2, 3. So those are the types of disabilities that we look at. So that is when you know who to see as a clinical psychologist, right? Because we were able to diagnose and to differentiate those disabilities with other disabilities as well. Let's say if you're not sure whether those symptoms falls under ADHD, autism, or SLD. So it's okay for you to come and see a clinical psychologist just to know where to go next. All right, because we can tell you whether this the behavior displayed are under the categories or it's not. If it's not and you want to know further, maybe we can direct you to pediatrician, developmental pediatrician. All right, so maybe those are the things that we can help you with at least.
Okay. All right. So when we talk about types of disabilities that a child need to see clinical psychologist, basically, what I heard from you is you see them as based on the characteristic, how they relate to a certain type of disabilities. For example, you said that it's a tantrum, then you have to see whether it fits the criteria of a child having autism. Okay, uncontrollable tantrums. And then if it's very active, it'd be like, does this child have a ADHD trait? So when we talk about types, in your point of view, it's like to look at the characteristic and the traits of such disability. And then another one you also mentioned, SLD, specific learning disability. Okay, all right. So this is where you can diagnose and differentiate what are the types of specific learning difficulties, right? Or disabilities. Okay.
So also I want to add there, when we talk about types or characteristics or traits, it's usually the traits that is very uncontrollable or it's very difficult for parents to control. So that's when we know that, you know what, I need to see someone to differentiate whether this is a normal behavior or it's not normal behavior. So those are the things, if you don't know what the characteristics of ADHD, autism, or SLD, so those are the things that you can look at.
Okay. All right, that's very good. So basically, if you talk about their characteristic, the traits, you have to understand what are the function, what are the purpose of this character. For example, if a child has a tantrum, then you have to see whether it's control or not control.
Exactly.
Okay, correct. So basically, if a child tantrum is defined as uncontrollable, that's where you have to further investigate what is.
Yes.
So
sometimes people may want to ask, like, what does it mean by uncontrollable? Right. So, for example, a normal tantrum is basically caused by not getting what they want. Right. For example, if they don't get toys, so they would show tantrum. All right. Sometimes the tantrum would not last as long as we, like, for example, not more than maybe 1 hour. All right. But if the tantrum, if you bring the child somewhere else, you try to remove the child to somewhere else, you try to persuade that child, the child still with the tantrum, not wanting to budge. So maybe those that can be considered as uncontrollable. And it does not only happen once, it happens most of the time. So that is what we mean is a prolonged and uncontrollable.
Okay. So the characteristic of being uncontrollable is have to be prolonged and happen multiple times. And then it doesn't, from
So
my understanding.
it does not only happen only one time.
Okay. And also it happened multiple times and without, I would say, without a proper reason. Okay, so
even if the reason is like there are reasons, but it's usually a very small reason, it's very uncontrollable. Yeah. For example, I want to wear this shirt. Like I always like to wear the shirt. So the child wants to wear the shirt. Even if the child is like the mom said that no, the shirt is being washed. So the kid like, no, I will still want or just cry and cry and cry until they get the shirt. So maybe that's something that you want to look at as well.
Okay. So it's more of like exaggeration, magnifying of a certain behavior. And so it's really hard for the child to control. Okay. All right. Okay. And then also some like these questions also been asked about quite a number of times, which I always heard, is the difference between a clinical psychologist and a psychiatrist. So,
okay.
Yeah.
So I often get that the question myself, right? So what's the difference between psychiatrists and clinical psychologists? Right? So one thing that you need to know, a psychiatrist has a medical background. It means they are medical officers. So their background is medicine. They study medicine and they further into psychiatrists, right? So they specialize their specialization is in psychology, which is the psychiatrist itself. Right? So as a clinical psychologist, our background is from the psychology background. So we don't study medicine, right? So we study psychology, right? When we talk about psychology, it's basically the mind and the behavior, right? So we study that and then we further into the masters of clinical psychologist or clinical counseling psychology, right? And then furthermore, the difference of psychiatrists and clinical psychologists is when psychiatrist is a medical doctor, so they are able to prescribe medicine. All right, so they prescribe medication if they seem necessary, right? But clinical psychologists, we can't prescribe medicine, right? But we can refer you to a psychiatrist for them to actually decide whether the child needs the medicine or not. So yeah, so basically that's a rough idea of psychiatrists and clinical psychologists. Psychiatrists, they can provide medication. Clinical psychologists do not provide medication, but they provide like assessment, psychotherapy, diagnosis.
Okay. Okay. So I see. So basically, the difference is, okay. First thing first, definitely the requirement is very different from what I heard. Okay, that's very good. So, requirement one is a trained medical doctors, and one is branch out from psychology. Okay. All right. And also you mentioned that so when in terms of explaining, correct me if I'm wrong, explaining mental health, so as a clinical psychologist, you tend to define it from a psychological factor for mental health or any disability, and then from the doctor point of view, he or she will define it in the medical way plus as well as psychological factors. So in return,
yes, you're right.
So so when they come in devising a treatment plan, that's where another differences is that they can prescribe medication as well to treat difficulty or disability or disorders, whereas clinical psychologists will be more on psychotherapies or approaches,
Yes.
psychological approaches or psychological theory in terms of helping the children to overcome certain disabilities.
Yes. That's right.
Okay, correct. All right. So basically, that's the major differences between a clinical psychologist and a psychiatrist. Okay, because sometimes some of the parents, they approach me asking me like, they can't really differentiate because a lot of the things that they do are almost similar. They both can screen, they both can diagnose. So parents are asking me like, so where should I go, or what do I need to do, or so it's good that we have this explanation from a clinical psychologist point of view, so that parents can learn from this, and then they know how to differentiate clinical psychologists and psychiatrists. Because I have parents also asking me that sometimes these two terms, clinical psychologists and psychiatrists, are interchangeable. So, but definitely for us in this field, it's not. It's two different things. Yeah, because these are the things that when we talk about mental health professionals, there's not many types of professional in terms of addressing mental health issues, which is also which included children with special needs like behavioral disorder, emotional disorder, and thoughts disorder. Okay, and then the next one. This is very interesting. This is this I have this question.
Okay, can I just add one more thing, Charlie?
Yes, please.
Before we go to the next question.
Yes,
Right.
yes, sure.
So sometimes parents also ask that, who do I see first? Like clinical psychologist first or psychiatrist, right? So that's a very good question that I always tell parents that if a place where you go has a child psychiatrist, might as well go for a child psychiatrist first, because they can screen out any medical issues, the ordinary symptoms that we mentioned just now, right? So it's better to go to see a child psychiatrist first. All right. So then maybe after seeing the child psychiatrist, so usually if there are diagnoses provided by the child psychiatrist, then we'll get the child psychiatrist diagnosis. But if you don't know who to see, or you don't know a child psychiatrist, you can always come to a clinical psychologist. So if there are medical symptoms that we see, there's a possibility that might be a factors to the symptoms or the traits. So we would just suggest who to go to see a child psychiatrist, or to see the developmental pediatrician. Yeah.
Okay, that's a very good tip. So basically, it's like the rule of thumb. Like if you don't know any child psychiatrist, you can always go to a clinical psychologist. But if you know a child psychiatrist, you can go to them first.
Because they're able to rule out the medical symptoms, which the clinical psychologists have limitations with. We don't know how to differentiate if there are medical symptoms.
Okay. So that's where what another differences are there, whereby if you can rule out medical condition, okay. So for most to those that join us today, some of the difficulties, it can be related or comorbid with other medical condition, so which require a medical doctor to address. So basically, if you go to a clinical psychologist, they can only rule out based on psychological factors. So whatever happened in your mind and thoughts or emotional, that will be addressed by a clinical psychologist. Okay, that's a very good tip. So basically, if you know a clinical psychologist, you can go to them to do a diagnosis, and then a clinical psychologist will refer you either to a pediatrician or a child psychiatrist. Okay, that's very good. Okay, so the next one. This is interesting. I have parents who approach me and asking like, I see that you're a counselor. What are the differences between a counselor and a clinical psychologist?
Okay. Maybe you want to share first what your role as a counselor in your mental health before I jump in?
Okay, yeah, sure. Okay, so what I always tell parents is the difference between a counselor and a clinical psychologist. It's very obvious. Uh, One of the most obvious part is we do not diagnose. Okay, a counselor, we normally do screening. We screen on basic, using a basic tools and basic, not even an assessment to screen the emotional or the mental state well-being of the child. Okay, counselors are not trained to do assessment unless you do some special training. But most of the time, what we do is normally we screen. We use some simple tools like DAS-21, PECS, inventory. So these are the things for us to screen if the child, what is the anxious level? Are they very anxious or are they very stressed when they right here, right now? So what's are the emotional like, and then that's where uh, the one of the difference between counselor and clinical psychologist. And secondly, what we do is mostly we do a lot of counseling and guidance, a lot of talking, okay, a lot of psychoeducation, providing information for parents as well as the child. Okay, what we do is we do a lot of talking, and we basically try to find out what is the child's struggle with. For example, if a child has learning difficulties, okay, they struggle with academic, okay, and also they struggle with the mental health well-being. For example, they feel stressed, they cannot cope. So that's where counselor will come in, and what we really do is we just talk with them and we provide guidance, okay, in a way that, okay, when you feel sad, what happened? So bringing out awareness to them to know that, or what are they do and what are the things, what are the alternatives they can do instead of doing such thing. And then, like for example, if I feel stressed, I tend to yell at my sibling, punch my sibling. So what we do in counseling is what else can we do? So we know that hitting is not right, hurting others is not right. So what else can we do? So we basically counselor and the client or the child work closely. Okay, it's like one is an actor, one is a director. So they work together in a movie, to create the movie. Okay, so basically that's what counselor do. And a third thing is we also provide guidance for parents. Okay, in that sense, it's like before you engage in any type of services, you can also come to a counselor to talk about your difficulties, your concerns. Okay, like you have a difficulty of picking treatment, where to go, what to do. So basically, when you go to a counselor, they will help you to untangle such concerns. And then if we detect that certain concern might be mental health related or is affecting your mental health well-being, or is affecting your daily functioning. For example, when a child comes to us because excessive crying, and then throughout the counseling session, talking to the child, if the child able to express very well, then we found out that if this child have difficulty in regulating emotion, because we suspect he or she cannot read, so they feel stressed, they start crying uncontrolled. That's where we will refer out to a clinical psychologist, because we don't do assessment. We can only assume, okay, and we can draw up assumption and also like a indication about what we think about and our opinion. That's where we will refer to a clinical psychologist, and also we work with parents in terms of to match parents' expectations and the child's ability. Okay, a lot of parents, when they that I experience with is when they come, their expectation doesn't match with the child's ability. So that's where, as a counselor, so we try to tweak, try to adjust parents' expectation to be applicable to reality. Normally, we experience a lot of unnecessary stress because of different point of view. Okay, like I want my child to be able to study or write when I know my child has difficulty in terms of fine motor skill. So that's where a counselor will come in and try to readjust the balance between that. Yeah. So basically, that's
Okay.
what
So
counselor.
yeah. So I think Charlie is very well versed with mental health. All right. So I think my story is very fortunate to have Charlie on board. Correct me if I'm wrong, Charlie, because counselors also deal with daily struggles. Am I right? Right.
Correct.
So they handle, like, for example, communication issues, interpersonal relationship issues, and all those kind of things as well. So, however, you need to also be aware that not all counselors are well versed with clinical issues as well. Am I right, Charlie?
Correct. Yes.
Right. So sometimes when you go to see a counselor, so you need to make sure the background of the counselor, not only the counselor, everyone that you see, you need to make sure their background, whether they're able to handle or to cater your difficulties or not. All right. If the counselor is not able to cater for clinical issues, so it's better for you to look for someone who's able to cater for that certain things as well. All right. So counselors also do give psychoeducations. When Charlie mentioned, like, explaining to parents what the needs and what the needs of the child, the mutual mutual understanding and whatnot. So that is what we call psychoeducation, right? So psychoeducation is super important. Clinical psychologists also give psychoeducation, right? So basically, that's the difference between counselors and also clinical psychologists, right? So counselors, they do the early part. So you see the counselors who are well versed with mental health issues or clinical issues. So they do the history background checking and whatnot, right? So if there is a need for further, for example, like assessment and whatnot, so they will refer to clinical psychologists, right? So same this to go to clinical psychologists. Sometimes I do have engagement with marital issues, couple issues. So sometimes if I'm not well versed in that area, I would also go find a marital counselors and give them a referral to go and see a counselor instead of just staying with me, not knowing what to do. So also we as a therapist or as a provider, we need to know the limitations of it. So one person cannot hold all the positions, right? So
Correct.
whatever limitations that we have, we need to acknowledge, we need to explain to the clients and why the reason we need to give a referral to other parties. Yeah.
Correct. Yes. Thanks for bringing that up, Liyana. Yeah. So if you're looking for a counselor, please do ask the background, because counseling is, I would say, it's not really broad, but we can cover a lot of things. So for example, like what Liyana is talk about, when we talk about interpersonal relationship, okay, how parents and child working together, okay, then you have to look for not only counselor that have experience working with children, but also working with family. Okay, so if you look for a counselor, you have to really know what are they doing. Okay, and also ask for their background. For counselor, it has to be registered. Okay, we have this thing called KBPA, which means you are registered. Counselor berdaftar is PA. And then PA is our practicing number. Okay, they have to do it biannually. Same goes to clinical psychologists, because at the moment in Malaysia, we don't have something what we call a pediatric counselor, okay, or a child counselor. So counselor is like one big umbrella. I assume it's the same, right, for clinical psychologists? Yeah.
Yeah, it is.
So the only way for parents to know is, if you come across someone who claim to have experience working, I mean, you have parents or teachers or other professionals, you have the right to ask what's the person's background. Okay. All right. So basically, that's the difference between a clinical psychologist and counselor. We all work together, counselor, psychiatrist, psychologist, we all work together because we address different things. Okay. Some might need medication and counseling. So that's how counselor and psychiatrist work. Okay. We also work closely with a clinical psychologist because sometimes, like for example, Liyana is working with the child and she found out that the interaction between the child and the parents, or the dynamic of the parents itself, between spouses, okay, there's friction. Okay, that's where counselor will come in as well to help. So we all work closely together. We have the same goal, but our approaches are different. Okay, our goal is to promote a healthy mental health well-being. Make sure that prevention as well for mental health, and also when we talk about in specific children with special needs, okay, autism or ADHD, it's not easy because there's always a stress in terms of taking care of children. Taking care of children itself is not easy. So if you have a child with special needs, it will be an additional stress. Okay, that's where we all have to work closely in terms of helping parents. Okay, so the next one is what are the commonly asked questions by parents for clinical psychologists? This is something that I've always been wondering. Like parents, they have questions. There's a lot of questions that they ask me, which now I'm curious to know from your point of view, what are the commonly asked questions from your side?
Okay, so actually there are a lot of questions posed by parents. Like one of them is it necessary for my child to go both occupational therapy and speech therapy at the same time, since my child is diagnosed with autism or ADHD, So those are the things that we need to explain the importance of each therapy, because both are providing different or are aiming at different things. So if the parents are incapable, like financially, there's financial restraints and whatnot, so I would suggest to go and focus on the basic needs. Like for example, if the child is unable to speak, all right, it's non-verbal, but just minor fine motor skill issues, minor gross motor skills issues. So I would suggest for the parents to opt for speech and language therapy. And then if they are financially stable, then they can opt for occupational therapy. All right. So, but there are different needs for both therapy. So that's one in terms of like, who do I go? Must I go both? All right. Second common questions that I get from parents are, what are the costs of this neurodevelopmental disorders? Right? Like, what are the costs? Why is my child being diagnosed with autism? What's the factor behind it? Why is my child being diagnosed with ADHD or SLD? So what causes it? Right? Is it me? Did I eat something wrong? Did I do something that I'm not supposed to do while during my pregnancy? Right. So sometimes we need to explain to parents, because sometimes they blame themselves, right? So they blame themselves as if they see that it's their fault. Maybe they did something wrong during the pregnancy. So when I explain to parents is that we need to see the statistic, right? So when we talk about neurodevelopmental disorders, usually when we talk about neuro itself, it's regarding to the brain, right? So it happened from birth. So you can't suddenly develop an autism or autistic characteristic at like 16 years old. So it's impossible for you to have that because it's usually from birth, right? So sometimes parents ask, is it because of what they do? So there are possibilities of hereditary, right, within the blood itself, the genetic, and also the environmental, right? But mostly when we talk about ADHD and autism, it's hereditary, which is within the genetic itself, right? So sometimes it's because of that. So why or how, like say for example, the parents are like, okay, but my family don't have any autistic person or non they have this ADHD traits. So why does my child have them, right? Again, like I said, when it comes to genetic, it's sometimes difficult for us to explain itself, right? Even researchers, even research article has difficulty explaining why, what causes autism, what is the definition, what is the defined root cause that causes ADHD as well, right? So those are the difficulties that we try to make the parents understand and not to blame themselves at the same time, right? So that's the second more commonly asked questions. And then the third commonly asked question is once they're diagnosed, once their child has been diagnosed, they would usually ask immediately, do my child have to take medication? How long does my child need to be on medication? Will it be for a lifetime? All right. So that one thing that we need to look at one by one. So we need to break out the process of taking the medication itself. So we need to see the characteristic of the child itself. So usually the medication, because that's what the parents fear most, the need to take medication for their child, right? So first of all, I would say that to look at the behavior itself, to look at the characteristic and the traits itself, right? If it's manageable within the therapy sessions, the occupation therapy or speech therapy itself. So it's better to make it manageable within those therapy, right? But if it's within the therapy itself, even the therapist complains that, oh, it's very difficult for them to actually pay attention, it's being aggressive, hurting himself, hurting someone else, right? So that I would have to suggest that, you know what, maybe you can see a psychiatrist to ask whether the child needs medication or not. So when I tell them to see a psychiatrist, I would always highlight this. When I ask you to see a psychiatrist, that does not mean that your child needs medication. It really depends on the psychiatrist, whether the psychiatrist see the child does need medication or not. So if it's not, then maybe there's intense therapy might be implemented. All right. If maybe the medication is provided, maybe they would definitely give the lower dose. They would give the higher dose, right? So I think the psychiatrist before this, because we had the interview with the psychiatrist, right? So I believe the psychiatrist would also say that once you started with the medication, do not stop on your own. So this is one thing also I have very common with parents. They ask me, can I stop? Because I think that my child is getting better. So I think that there's no need for medication. You know, other people have stopped their medication on their own. They're still fine or whatnot, right? And that's a very, very important thing to highlight is that once you start medication, if you want to stop the medication, always refer back to your psychiatrist, right? Regardless if it's like you haven't seen a psychiatrist for 10 years or 6 years. So always go back to your psychiatrist, ask for a second opinion, you know what, this is my updates for my children. So my child has no longer displaying aggressive behaviors, no longer meltdowns, being able to control their emotions and whatnot. So that is possibility. There's a possibility for the psychiatrist would advise to maybe slow down the medication, not to immediately stop. They would always say that, okay, if you're on this level, maybe we need to go to lower and lower and lower and lower until the fact that, okay, you know what, this is the lowest dose that we can give, and I think that your child is okay. So the psychiatrist always advise in that sense. All right. So always parents, if you want to stop the medication, always go back to your psychiatrist, go back to your medical doctors and see and ask whether if they can stop the medication do not stop on your own. So that's very important.
Okay, thanks for sharing. Yeah, I do encounter such events before, or such similar situation whereby parents stop the medication by itself. So what I what I normally share with parents is like, when you go to a GP because of virus infection, where you require to take antibiotic. Okay, so antibiotic you don't stop just because you no longer have an issue like fever. No, you no longer have issue of flu or whatnot, but you don't stop the antibiotic by yourself, because normally the doctor just say finish it, even though you feel healthy, it doesn't look like you have any sickness anymore. But please do not stop any medication, because we don't sure physiologically how it will change if you stop by itself. It has to be under the guidance of a psychiatrist. Okay, all right. So basically, the common questions that you encounter is, first is financial. Okay, how much does it cost, to see a clinical psychologist? Okay, and then secondly, the questions that you encounter with is, what other necessary professionals like OT and speech, am I correct, that needed? Right? And then the third one would be like,
what causes it?
Yeah, the causes of disabilities, like neurodevelopmental disorder like autism, ADHD. Yeah, well, it's quite tough questions, because we don't really have a direction how it will happen. Like basically, it's very broad. Okay, yeah, it's really difficult sometimes for parents when they found out that my child has certain neurodevelopmental disorders, which can be it's very hard, because normally when we talk about medical related issue, okay, there always a cause, but in this situation, there's at the moment it's quite broad. We can't really pinpoint what are the causes yet. Okay, and then the last one will be medications. Yes, these are nothing. It's really good. So before we move on to the next question, anyone that attend, if you have any question, please put it in the comment box so I can relate it to Liyana. If you have any questions, like the role, to understand the role of clinical psychologist, please feel free to put it in and ask questions so I can refer it. And I apologize that if her line is breaking up. But if you have any question, or you feel like you want to hear more about a certain area or certain question, do let me know. Okay, I can answer, and I can also like sort of like summarize her answers to you all. Okay. All right. So the next one is like it's pretty similar. The commonly asked questions to you, or some of them I have encountered as well. Yeah, it's really sometimes it's tough to provide a certain answer when we ourselves, we don't exactly know what's going on. Okay, all right. So after the common questions that you have experienced, okay, what would you suggest to parents to do or prepare before meeting a clinical psychologist?
I think that is a very, very good question, because sometimes parents see clinical psychologists and they don't know what to provide information, right? And they don't know what to do before seeing a clinical psychologist. All right, so one thing that before you come see a clinical psychologist or even a psychiatrist, one thing you need to know or be aware is basically the developmental stage of your child. All right. because it's important because that is what we want to know. All right. For example, the intensity, the frequency, the duration of it. For example, if like for example, my child is having tantrum, right? So we want to know what causes the tantrum. Usually, in on average day, what usually causes the tantrum? So how long? So the duration. How long does the tantrum last? All right. Was it easy for you to handle? Was it difficult for you to handle? All right. And the second thing is the frequency. So how frequent does the tantrum usually display within a day? All right. So is it like almost every hour? Or is it like most of the time? Or is it like only like once a day? Or maybe once a week? All right. And then that is intensity itself, right? So the intensity is basically like for the tantrum subside, you know, as the sun goes by, or does it like increase um, the tantrum? So basically, those are the questions that we need to look at. So basically, we want the parents to have a clear observation for us as a therapist, so that we know where to put our benchmark for the child as well. So sometimes I have parents coming in, like when I ask them things like, okay, what you notice if like this social interaction happen. For example, the parents coming in, you know, my child is not interacting, is not playing, is always being alone. Okay, so I would always ask, how long do you see that this is happening, right? So sometimes the parents were like, I'm not sure because I'm rarely home, but most of the time when I'm home, like the child is not engaging. All right. So we don't know what happened when the parent is not at home. Sometimes when we send to, like for example, Tasca or kindergarten, they would have engaged with children elsewhere. It's just that at home they would prefer to be by themselves, maybe. All right. So those are the things that we need to know. Sometimes I would always ask like, before maybe after this you can come back, or you can text me, or you can email me the report from the teachers. You know, what did the teachers say? What are the observations that the teachers see at the kindergarten? You know, just so that we know that what happened during when the parents are not there to observe. All right. So those are the things that's very important for you to actually know about your child itself. Right. So if you kept on coming, if you kept on saying like, I'm not sure, I don't know, I haven't seen this as much, so it's going to be difficult for us, and the duration is going to prolong. So instead of it can be done like within a month or two, maybe it's going to take longer because we need information from other party. We need information to be, we need observation duration as well. So those are the things that is important for parents themselves to actually know their child better in terms of their developmental milestones, right? So if the parents don't know, okay, I don't know what are the normal developmental milestones, right? From the photo, right? So KKM, let's say KKM has put out the developmental milestones PDF, right? So you can just go to the website and just download it, and you can see from 0 to 6 months what are the normal developmental milestones that they should display, right? They could see until, if I'm not mistaken, until early teenage, from 16, 12, around that area. Yeah. So that's one of the important things for parents to at least know before coming to the clinical psychologist or psychiatrist or counselors.
Okay. That's a very good point. Okay. So basically, there's three things they need to prepare. First is to know why is it because why they want to come here and see you? The purpose. They have to know the purpose of meeting you. Secondly, is the frequency of certain concern. For example, first they have to identify what are the concerns they have when they meet you. So basically, parents have to prepare. So before you meet a clinical psychologist, you basically have some concerns, and these are the concerns that you have to lay out to the clinical psychologist. And when you have this concern, you also have to know the frequency of certain behaviors. Okay, like for example, correct me if I'm wrong. I want to see you, Liyana, because my child has been crying non-stop. Okay, so when I have this, I have to have a basic knowledge of like how frequent is this crying happening. Okay, and also the third thing is to know the intensity. Okay, how how frequent and how not, is it okay to say severe?
More or less, yeah.
So these are the three things that you want parents to be prepared with, to have information readily available. Okay, because you also mentioned that it's really hard to gauge the child's, you don't have a benchmark if the parents doesn't have certain information readily for the child, for you. Okay, so yeah, for parents who are attending today, these are the three things that Liyana would suggest our parents to be prepared with. Okay, to know your concern, okay, and to know how frequent is certain behavior or emotions, or it is related, it will be related to your concerns as well. Okay, and then the intensity, how intense is it? Okay, is it and how fast? Or yeah, it can be like, you know, 0 to 10 minutes, like less than 10 minutes, to burst into crying, and then it lasts frequency. It happens few times a week, and then it can last very long. Okay, and also you did mention that parents can also monitor their developmental milestone.
Yeah.
Okay, it's in the KKM
Website.
website. Okay, this is for parents to monitor.
Yeah. Yes.
Okay.
At least to know what are the normal developmental milestones and the typical developmental milestones and the atypical developmental milestones. At least you know where.
All right, so we're already at nearly at the end of this Facebook Live. Let me ask, can I ask you a last question before we end this? Okay, so for those parents that are looking for clinical psychologists, like for counselor, we have a license and we have to be accredited by the Lembaga Counselor Malaysia. So this will be the, this is my last question to you. Oh, how do you know if a clinical psychologist is, is properly accredited or licensed?
Okay, so like counselor, they do have the association, right? So clinical psychologists, we do have our own association as well. So it's called MSCP, so Malaysian Society of Clinical Psychology. All right. So you can just go to mscp.com. All right. However, sorry. So in the MSCP itself, we have a list of members. So those who have registered under the MSCP, so their names would be registered in the website itself. Right. However, there are some clinical psychologists who haven't registered themselves yet due to they haven't registered their membership yet under the MSCP. That does not mean that they are not accredited clinical psychologists. All right. So because we have in Malaysia, we don't have what do you call that? A compulsory for us to actually be under a society. So we don't have that yet in Malaysia. But if you want to know who are accredited under the MSCP, because we have this association who actually monitors our clinical psychologists, so that would be under MSCP. You can go on the website and see who are, like, for example, if you go to certain centers. So you want to see whether if those clinical psychologists are under the MSCP and you would want to transpose the MSCP more. So you can have the option to actually go to MSCP, right? But also understand that not all clinical psychologists registered under MSCP, and it does not mean that they are not accredited clinical psychologists.
All right. So basically, there's no mandatory yet for accreditation. But for those who are accredited and practicing, you can look at the association called MSCP. Am I correct? Okay. All right. So
yes,
everyone that are registered or are accredited by MSCP, they will have the number. Okay. All right. So parents.
Yes.
So those who are looking for clinical psychologists and you want to make sure that they're accredited, you can log on to MSCP Malaysia to find out. You can find out the name and if they're accredited. Okay. All right. So we're already at the end of our Facebook Live. Thank you for joining us today, Liyana. And for those, if you're looking for a clinical psychologist or if you know someone who are looking for a clinical psychologist and you need some suggestions or recommendations or screening, do give us a call. You can find our phone number or email, or you can Facebook Messenger us at Mind Story. Okay, and then we can schedule an appointment with you, with Liyana. Okay, all right. Thank you, everyone. Thank you, Liyana, for joining us today.
Thank you for having me.
Okay, stay safe. Have a good day. Bye-bye.